Hello, and thank you for taking the time to listen to this presentation to learn more about Medicare and Medicare supplements. Medicare is a social insurance program that was established in 1965, created to help those people that are age 65 and older, those who are disabled, or those who have permanent kidney failure. Currently, Medicare provides coverage to almost 54 million people. This makes the senior health market full of strong potential sales opportunities for Medicare supplements and other senior health products. Medicare consists of four basic parts. There's your traditional Medicare, which is Medicare Part A is your hospital insurance. Medicare Part B is your medical insurance. Part C is commonly referred to as Medicare Advantage. And Part D is prescription drug coverage. Most people receive Medicare Part A premium free because they or a spouse have 10 years or more of Medicare covered employment. People with less than 10 years of Medicare covered employment can still get Part A, but will have to pay a premium. As demonstrated on this slide, Medicare can be quite costly. There are significant out-of-pocket expenses beneficiaries will have to incur. These amounts can change each year and certainly explain why additional coverage, like Medicare supplements or Medicare Advantage plans, that help pay for these out-of-pocket costs are a necessity in today's senior health market. Medicare Part B is the medical insurance portion of Medicare coverage. Unlike Part A monthly premium is required from everyone for Medicare Part B. The amount of this premium can change every year beginning January 1st. The base premium is currently $104.90, but is expected to increase for those new to Medicare and those not currently receiving Social Security. Higher income beneficiaries will pay $104.90 plus an additional amount based on the income-related monthly adjustment amount that will be detailed on the next slide. If you don't sign up for Medicare Part B when you're first eligible, or if you drop Part B and then get it later, you may have to pay a late enrollment penalty for as long as you have Medicare. Your monthly premium for Part B may go up 10% for each 12-month period that you do not have other credible coverage and could have had Part B but did not sign up for it. Enrollment into Medicare Part B has several different options. Most commonly is the initial enrollment period, which is 3 months prior to the month of an individual's 65th birthday, the month of their 65th birthday, and no later than 3 months after the month of their 65th birthday. There's also special election opportunities to enroll into Medicare Part B. If the Medicare beneficiary has credible coverage at age 65, he can decline Part B enrollment and enroll later when losing that credible coverage. Once the employment or coverage based on current employment ends, that individual has 8 months to sign up for Part B without a penalty. This period will run whether or not they choose COBRA coverage. So it's important that if one does choose COBRA coverage, to not wait until the COBRA coverage ends to enroll in Part B. If one does not apply for Medicare Part B when first eligible, or qualify for a special enrollment opportunity, that person can then only enroll during the general enrollment period, which is January 1st through March 31st of each year, with coverage effective on July 1st. Here you will see the Medicare Part B premiums for higher income beneficiaries. Individuals earning $85,000 or more will have to pay a higher premium for Medicare Part B. Couples who file jointly will have to pay higher if they earn $170,000 or more. Here's a listing of some of the services that Medicare Part B covers, including doctor services and outpatient care, preventative services, diagnostic tests, certain therapies, and durable medical equipment. In addition to an individual's monthly Part B premium, there are other deductible and coinsurance expenses to be considered by beneficiaries, such as the annual deductible that can change every year, and the 20% coinsurance for most services after the deductible has been met. Medicare Advantage, or Part C, must cover at least what Medicare covers. It replaces Medicare, but one still has to pay the Part B premium. By replacing Medicare, that means that one who has a Medicare Advantage plan and they go to their provider, the provider will submit their claims directly to the Medicare Advantage carrier and not to Medicare. Medicare Advantage plans cost zero to little premium per month in exchange for high out-of-pocket costs. For Medicare Advantage plans, you can only enroll or switch during certain times of the year, like the annual open enrollment period that is October 15th through December 7th of each year. Medicare Advantage plans are also network-based plans, HMO or PPO plans, but there are some non-network-based plans called private fee-for-service plans that are more relegated to rural communities. Medicare Part D is the outpatient prescription drug benefit. It's operated by the private carriers and subsidized by our federal government. Plans can vary substantially, covering different drugs and charging their own premiums and co-pays. To join a Medicare Part D plan, one must have Medicare Part A and or Part B. It must be comparable to the standard coverage. There's also a late enrollment period for Medicare Part D. If one does not get Part D when first eligible, does not have other credible coverage, they'll have to pay a penalty of 1% of the average national premium for every month that one did not have Part D coverage but should have. This penalty is assessed to the plan's monthly premium. Medicare Supplement plans cover the gaps in Medicare, the deductibles, coinsurances, and copays previously mentioned. These amounts can change each year, and Medicare Supplement coverage covers these new amounts. Medicare covers less than half of the beneficiary's total costs. In 2010, the Center for Medicare and Medicaid Services estimated that Medicare beneficiaries spent $4,734 out of their pocket for healthcare expenses. Medicare Supplement plans are guaranteed renewable, meaning that as long as policyholders pay their Medicare Supplement premium, the coverage is guaranteed to stay in force. With Medicare Supplement plans, one can see any provider that accepts Medicare. No referrals are needed. Medicare Supplement plans are sold by private insurance companies. They're standardized plans, so individuals can compare easily. Costs may vary by company, where an individual lives, and by plan. Medicare Supplement plans must follow federal and state laws and can only cover one individual. Exceptions are applicable in the states of Massachusetts, Wisconsin, and Minnesota. Here you will see a slide that demonstrates the Medicare Supplement plans that are currently available. Medicare Supplement plans are referred to by letters A through N. The Plan F is a leading plan sold amongst all carriers. While Plan F remains the most popular plan, the Plan G can be a smarter choice, and it can provide significant savings versus Plan F, and rate increases can be less. Also, an alternative plan to Medicare Supplement plans is a Medicare Select plan that mirrors the Medicare Supplement plans with the exception of using an in-network hospital so that the Part A deductible is waived. Therefore, Medicare Select plans are usually less premium. Medicare Supplement plans cover basic benefits. Most plans cover the Part A coinsurance for inpatient hospital care, the cost of 365 extra days of inpatient hospital care. Medicare Supplement plans pay for Part A hospice coinsurance, which covers the $5 copay for outpatient prescription drugs or pain and symptom management, and 5% of the Medicare approved amount for inpatient respite care. Medicare Supplement plans pay for the Part B coinsurance, which is 20%, after the deductible has been satisfied, and the first 3 pints of blood each year. Medicare Supplement plans can distinguish themselves by pricing. Carriers can charge different premiums according to male and female rates, tobacco or non-tobacco usage, the area in which one lives in, usually by zip code. Carriers can distinguish themselves and offer more competitive premiums by offering discounts, like a household or a spousal discount, and can certainly adjust their pricing for risk involved. Rate adjustments occur annually with Medicare Supplement plans to help keep pace with the rising Medicare claim trends and changes in annual deductibles and copays. It's important to note that all adjustments are not always increases. Sometimes we have seen price decreases or no changes at all for carriers to make their plans more competitive. Enrollment into a Medicare Supplement plan during the open enrollment period is a 6-month period that starts the first day of the month in which one is at least age 65 and enrolled in Medicare Part B. During this period, an insurance company cannot deny a person any Medicare Supplement policy it sells, make a person wait for coverage to start, or charge a person more because of their health conditions. Medicare Supplement plans also have guaranteed issue rules. If one has passed their open enrollment period, where they have been enrolled in Part B for more than 6 months, they may still have an opportunity to receive Medicare Supplement coverage if they qualify for a guaranteed issue scenario. Involuntary loss of credible coverage that was primary to Medicare is the most common guaranteed issue scenario. If this were to occur, a beneficiary then can enroll in Medicare Supplement plans A, B, C, F, K, or L, guaranteed issue. Plan G is not available in this guaranteed issue situations. There are other guaranteed issue situations that are specific to losing Medicare Advantage coverage. Insurance carriers can often pay a lower commission for guaranteed issue business as well. If one is outside their open enrollment and a guaranteed issue situation is not applicable, beneficiaries can enroll in a Medicare Supplement plan at any time, but be subject to medical underwriting. Medical underwriting can be applied and based upon answering of all the health questions on the application, indicating the height and weight, the medications that one takes, and can be subject to pre-existing conditions in the state of New York. If someone is under the age of 65 and receiving Social Security disability payments for 24 months, he or she is then eligible for Medicare. However, Medicare Supplement plans for those under age 65 are not required by federal law and only available in select states where the laws require it. Underwriting may be required to purchase a Medicare Supplement policy in all circumstances. Open enrollment and guaranteed issue rules previously mentioned are not mandated to be provided for those under 65. However, if a person has Part B when they reach age 65, they have the right to choose and buy any Medicare Supplement policy during the open enrollment period, even if they had Part B before age 65. Medicare Supplement plans, although standardized, are different among carriers. Carriers can distinguish themselves by the premiums that they charge, the plans that they offer, the customer and producer services that they provide to their sales producers, and to their policyholders. Carriers will do an excellent job of distinguishing themselves by the brand image that they have in the marketplace. Carriers will also distinguish themselves by offering value-added benefits like a gym membership or a nursing hotline for people to call upon to get advice. Carriers will also offer certain discounts like a household or a spousal discount. There's a new Medicare law passed this year. The Medicare Access and Chip Reauthorization Act of 2015, or the Doc Fix, repealed the sustainable growth rate and replaces it with payment increases for doctors for the next 5 years as Medicare transitions to a new system focused on quality, value, and accountability. This new law rewards quality of care and not volume. As part of this law, Medicare Supplement plans will no longer be used to pay the Part B deductible beginning in 2020. Thank you for taking the time to view this presentation and learn more about Medicare in the senior health market.